Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP. Well, I'm very pleased to introduce to you today Kate Ketelhohn. Kate is the 2023 Breece Fellow. Kate, take it away.
Hi, everyone. My name is Kate, and I'm thrilled to be your 2023 Breece Fellow. I have been in D.C. for the past week, and I have been learning a lot. A little bit about me is that I'm natively from Wisconsin, and I am currently a rising junior at Johns Hopkins University. I am studying biology on the pre-med track with hopes of entering medical school.
Kate, tell our members and friends a little bit about your use and experience with orthotics and prosthetics.
I have been using O&P nearly my entire life. I was amputated at 8 months old as a result of sepsis, so I have 2 partial feet and no left hand. As a result, I wear orthotic prosthetic combos on my feet and a prosthetic on my left arm.
So Kate is going to be going on a number of field trips to understand O&P clinical practice, has already had some Hill visits on Capitol Hill. We're also going to be asking Kate, and she's in the middle of doing some research on a VA project, and let me ask Kate to explain exactly what she's doing.
So the VA recently retired its VA handbook. As a result, they have released new rules and regulations in regards to orthotics and prosthetics. So I've been going through this new rules and regulations, and I'm working on compiling a summary to see what rules we are now working under.
There'll also be a white paper that Kate will work on osseointegration. Talk a little bit about that, if you would.
Awesome. So osseointegration is a newer technique for prosthetics to be implemented. And it is designed for people who typically cannot accommodate wearing a socket prosthetic. So I will be looking into the rules and regulations for osseointegration and summarizing that in the white paper.
In July, Kate will help with a webinar that NAAOP plans to put on for its members and friends around the Medicare Advantage final rule. And let me talk just a little bit about this, because this new rule went into effect this week, June 5th. The Medicare program published a final regulation that creates a whole new set of standards for practitioners to use in pushing back and fighting denials of O&P care, either through prior authorization or through claim denials after the fact. Under the new rules, practitioners will be able to assert that coverage rules that the Medicare Advantage plan is using do not comply with the Medicare fee-for-service program, including the statute regulations, national coverage determinations, local coverage determinations, and the like. If they do use internal guidelines or coverage requirements, those requirements will have to be publicly available, transparent, developed through a utilization management committee, and will be much more visible to the public than they used to be. In addition, any reviewer that denies a claim will have to have certain education, training, and experience in the medical area in which the claim is being processed. So that will also help, we believe, reviewers to better understand orthotics and prosthetics before claims are denied. It's a really great new set of tools that practitioners will be able to use, and we'll be going into depth to arm O&P practitioners with this new information in July. And finally, Kate is going to be helping with the Virtual Fly-In, NAAOP's Fly-In, also scheduled for July. Kate, you want to talk a little bit about that?
Yes. So at the Virtual Fly-In, we will be meeting with members of Congress to see if they would be interested in supporting O&P legislation that our community has long time supported.
The O&P Patient-Centered Care Act, soon to be introduced, was the main legislation that was supported and that we advocated for through the O&P policy conference earlier this spring. and the NAAOP will be ultimately continuing that advocacy through its virtual fly-in in July. So, Kate, take it away. Thanks so much. We'll be back with more updates, and thank you very much for your support of NAAOP and the fellowship program.
Yes, thank you everyone for your support.